show them love and we show them compassion. That's the desire.
You lose him?
Who lost him?
Elder. He dropped, I think.
Maybe he accept when somebody asks for his live stream and it asks us accept or leave. So maybe he left.
He must have picked up leave.
Absolutely, yeah. We are live on our CFSM Facebook page, so probably okay.
Pastor Fikru, you can give to the next person and they will join us, because since we are live, I think that's a wonderful thing.
Wonderful. So we'll go with Dr. Arubak. We'll go with Dr. Osman Ahmed from East African Health Project. Dr. Osman is going to speak in Somalia.
Good morning, everyone. Good afternoon. Assalamu alaikum wa rahmatullahi wa barakatuh. Walaalayaal, maanta waxa weeye.
Daniel is back.
Yeah, I'm back. I think I lost the power.
2021 waxaa isxasuusinayaa maalin kasta December ah ee dhibaatada uu cudurka HIV/AIDS ku hayo adduunka. Adduunkoo dhanna cudurkaas wuu gaaray. Tira aad iyo aad u furan oo millions qof ayaa u dhintay, ilaa 25 milyan baa u dhintay. 40 sano cudurka isaga ay jireen. Ilaa haddana wuu u badan yahay. Soomaali ahaan aad iyo aad buu noogu fara badan yahay cudurkaas. Statistically hadda 2020 la soo saaray, Soomaalida 159 qof oo Minnesota ku nool ayaa cudurkaas qaba. Arrintaas iyada ah waxay u baahan tahay Soomaalidu inay si degdeg ah wax uga qabato, ka wada hadasho. Cudurkan waa cudur la iska ilaalin karo. Cudurkan ma aha cudur qofka soo doonanaya, qofka ayaa cudurka doonanaya. Marka waxaa loo baahan yahay in cudurka la iska ilaaliyo. Waa cudurrada la iska ilaalin karo, si fiican la iskaga ilaalin karo. taas waxay na tusaysaa waxa weeye cudurkan oo cudur la iska ilaalin karo oo waxyaalaha lagu kala qaaday ay iska cad yihiin in dadku uu maaragtay qarsado ama ka xishooda maaha. cudurkan dhibaato xoog loo waadaa. cudurkan waad ogtihiin oo wuxuu ka mid yahay cudurrada galmada looma kala qaado. Soomaali haddaan nahay waxaa yaab leh cudurka HIV waa ka xishoonaynaa, laakiin cudurka hepatitis B-ga kama xishoonayna. labadan cudurna waa laba cudur oo walaalo ah, isku si baa loo kala qaadaa. marka midna waa ka xishoonaynaa oo waxaan leenahay ana laga baaro, midna waa qarsanaynaa. taas macquul ma aha. waxaa loo baahan yahay haddaan Soomaali nahay cudurkan inaan ka wada hadalno. culimada, aqoon-yahanka, macallimiinta, hooyooyinka, aabbayaalka, qof kasta oo Soomaali in cudurkan HIV/AIDS ka lala dagaalo oo laga hadlo sida cudurkan iskaga ilaalin. waa ku celinayaa mar kale, cudurkan ma aha cudurrada dadka raadsada. hadda COVID-19 waa cudur dadka raadsanaya, waa cudur adoo halkaa jooga kugu soo bidaya, laakiin kan saas ma aha, kan adaa raadsanaya. marka waa inaad iska joojisaa oo aad taqaanaa sida lagu kala qaado iyo sida la iskaga ilaalin karo. arrintaas iyada ah aad iyo aad bay muhiim tahay haddaan Soomaali nahay. arrintaana waa wadanaa, dagaalkan ma joogsanayo. waa cudurkan khatar waaye. hadda waa la iska hilmaamay, kan baa laga fakeraa kale, laakiin cudurkii sidiisii u jiraa waana badanayaa. intaas dagaal xoog la ka muujina fadlag waan ka wada shaqayn doonaa insha Allah. Assalaamu calaykum waraxmatullaahi wabarakaatu. Sorry if you don't understand my language.
Thank you so much, Dr. Osman. That is a very brief and a clear presentation, even though I can't understand Somali. I've been with you for the long time, so that I know what you're talking. So Thank you so much for your service, for your presentation. Now, Dr. Ofsa Hassan has joined. He's from Central Family Clinic, and then he's going to make a brief presentation at the end. He's my keynote speaker. So that welcome, Dr. Ofsa. So we'll go back to Elders Daniel from United Central Seventh-day Adventist. You will finish your presentation so that we'll move on to another person, the next person.
Okay, thank you so much. I got disconnected. So as I was saying, we have embraced this program so that we can pass information to our people on prevention methods, on treatment cares that is available, and more especially on how to avoid being infected by this disease. The service has brought a lot of impact to the people. There is no more stigmatization. You know, AIDS usually had stigmatization. People used to be, you know, isolated. But now we can talk freely amongst the youths and amongst the older people at the church in small groups so that the people are aware of this disease. We have broken those social, you know, barriers that used to be there, that a parent cannot talk with the, you know, Africans, the way we look at it. But now there is a greater awareness, and we have seen a reduction. We have not had any issue or any cases within our congregation. So we believe it's really creating a big impact. My simple message to all of us who are providing these services is to keep on the fight against the epidemic. There are so many challenges. There are uphill tasks, but if we keep on, we don't give up, at the end of the day, we will be able to save many lives in this world. Thank you so much. That's our brief presentation.
Thank you so much for that clear, precise, and good presentation. I'm glad stigma is the biggest problem in HIV/AIDS, but I'm glad to hear that the stigma is reducing in your community. And so that is extremely promising and exciting. Thank you so much. And
we are showing love and compassion to those who are infected. So
thanks so much. So we'll move on to the next presenter, that is Mr. Iticha Guddata from Oromo Diaspora Media. He's going to present in Afan Oromo.
Thank you. As Pastor Fikru said, I'm going to speak a few words in Afan Oromo, so most probably some of you may understand what I'm saying. So let me change the channel and speak in Afan Oromo. Akkam jirtu fayyaa keessanii dhimmoota irratti dubbannu keessatti keessumaa dhaabbanni Sub-Saharan African Youth and Family Service in Minnesota jedhamu erga waliin hojjechuudhaa qabnee amma gara waggaa lamaatti kan nuyi darbaatti jirru. Haa ta'u garuu dhaabbanni kuni waan jabaa, waan guddaadha kan inni filatee, keessumaa wayita namoonni nama moggaa qabsiisanii, keessumaa dhimma HIV/AIDSdhaan namni yoo qabame nama moggaa qabsiisu, garuu dhaabbanni kun immoo namoota moggaatti daangeffamanii jiran kanaa fi hirkoo ta'uudhaan bira dhaabbachuu isaanii yogguun argu baay'een gammada. Kanaaf isa kana keessatti immoo qaama dhaabbata kanaa ta'ee waliin hojjechuu koof akka dhaabbata Oromoo Diaspora Miidiyaatti baay'een gammada. Haa ta'u gaa dhaabbanni keenya dhimma kana waliin hojjechuudhaaf, keessumaa dhaabbanni keenya dhaabbata miidiyaati. Dhaabbanni miidiyaa immoo qabxiilee gurguddoo sadii raawwata miidiyaanii. Inni tokko to inform isa jennudha, yookiis odeeffannoo kennuu isa jedhudha, odeeffannoo barbaachisaa ta'e jechuudha. Inni kan biroodha, inni lammaffaa to educate kan jennudha, yookiis immoo barsiisuu, uummata barsiisuu isa jedhu. Fakkeenyaaf hubannoo kennuu isa jedhu irratti, keessumaa gama HIV/AIDS ta'e health disparity yookiis immoo almadaalii fayyaa kan jedhu irratti dhaabbanni kun si'oominaan waan hojjetuuf isa kanarratti miidiyaan keenya haga danda'ame waliin hojjechaatti jira jechuudha. Inni kan biroo miidiyaan to entertain kan godhudha, yookiis immoo nama bohaarsuu yookiis bashannansiisuu kan jedhudha. Haa ta'u garuu dhaabbata kana waliin kan waliin fuulleffannee isa tokkoffaaf lammaffaadha jechuudha. To inform and to educate isa jedhu barsiisuudhaa fi haaluma wal fakkaatuun odeeffannoo kennuu isa jedhudha. Haa ta'u egaa wayita waa'ee fayyaa haasofnu dhaabbilee garaagaraa faana dhaabbanni keenya hojjechaatti jira. Dhaabbatoota fakkeenyaaf kan akka Sub-Saharan African Youth and Family Services in Minnesota dhaabbatuma marattaasaa jirru. Inni kan biroo immoo biiroo fayyaa Minnesota MDH waliin dalagaatti jira. Haaluma wal fakkaatuun dhaabbata Welshare International jedhamu waliinis dhaabbanni keenya dalagaatti jira yeroo hundeeffama isaa dhiyoo haa ta'u malee kana qofa otoo hin taane Ramsey County waliin haaluma wal fakkaatuun dhaabbilee garaagaraa afaan hiikan waliinis dhaabbanni keenya bal'inaan hojjechaatti jira. Fakkeenyaaf kan akka Global Language Services fi haaluma fakkaatuuf immoo LG Interpreting kan jedhuu fi dhaabbilee garaagaraa maqaa isaanii mention gochuu hin barbaachisne ammaaf danuu faana hojjenna. Haa ta'u garuu isa kana keessatti dhaabbanni kun hojiiwwan hojjetu keessaa keessumaa namoota keenya barsiisuu irratti kan inni hojjetu. Haa ta'u garuu yeroo adda addaa namoonni waa'ee fayyaa kana baay'ee dhaga'uun barbaadan jechuun fakkeenyaaf keessumaa akka saba keenyaatti yoo fudhanne rakkootu gara biyyaa jira waan ta'eef gara Oromiyaa kana keessa rakkootu jira waan ta'eef yeroo baay'ee kan isaan dhaggeeffachuu barbaadan dhimma siyaasaa yoo ta'e inni kun keessumaa dhimma dhibee vaayirasii koronaa yogguutti uummata barsiisuudhaaf keessumaa garee Dr. Obsaampaa jiranii kan akka Access Family Clinics ta'e kanneen akka Ayooppaa waliin yogguu hojjennutti namoonni isa kana baay'ee dhaga'uun barbaadan fakkeenyaaf riichii isaas yoo ilaalle namoota daawwata yoo ilaalle xiqqaadha. Haa ta'u garuu dhaabbanni kun Sub-Saharan African Youth and Family Service hojii guddaa hojjechaatti jira. Keessumaa yeroo darbe dhimma hundeeffama isaa faana wal qabatee obbo Ifreem Olaanii fi aadde Elsaabeet namarraa dubbiseen ture warra dhaabbata kana hundeessan. Yogguun dubbisu keessatti keessumaa maamila isaanii kan ta'e namni tokko osoo laayivii irra jirru dhiyaatee jooyinan godha malee jedhee dhugaa bu'umsi namni sun waa'ee gochaa isaan godhanii fi yogguu kaasu inni kun baay'ee na gammachiisa yeroo kamii olitti iyyuu. Yogguutti namni nama moggaa qabsiisee nama dagatetti dhaabbanni akkasii nama bira dhaabatee namaaf dahoo ta'uunsaa inni kun waan guddaadha jechuudha. Tarii egaa baay'een isaanii as ba'anii dubbachuudha hin barbaanne yookiis of mul'isuu hin barbaanne malee baay'ee isaaniitu isa kanaaf galata qabaa jechuudha. Tarii egaa afaan Oromoo waan haasa'uuf akkuma waa barreessuu dheerateen si'a haa ta'u yogguu yaadannoo tokkoon isiniif dhiyeessa keessumaa yogguu xiqqaa turre eersii kana mana barumsaa keessatti baay'ee ka'aa ture waa'een eersii tarii walaloo isaa yoon dagadhee hin beeku barreeffadhee dhiyaadheen qabu na of kolchaa qabxiileen irratti dubbadhaa jedhames qabxiima baay'ee murteessaa baay'ee barbaachisaadha waan ta'eef garuu waan tokkon jedha walaloo dhiyeessina ture yogguu elementarii barannu yookiis immoo sadarkaa tokkoffaa tarii yoo walaloo ishee dagadhee na of kolchaa yogguu sana garuu qomaanan dhiyeessaa ture atoo walaloo barreessiteen beektu gurbaa oduu faana himta akkamitti walaloo dubbatte kanaan hin jenne akka jenna ture. Yaa eersii jedha mata dureen isaa ka'een isiniif ibsaa waa'ee daddarba isaa eersii yaadoolessaa ka'een seenaa odeessaa eersiin nama nyaata kukkutee sigata safuu yaadinqiisaa Ameerikaatti dhalattee dhuftee Afrikaatti taphattee kan jedhuu fi kanneen biroo dhagaa hin xumurre guutummaasaa keessumaa yogguu sana akka aadaa Oromootti yogguu sana waarsaa kan jedhamu faatu jira nam tokko yoo fuudhee waarsaa kan jedhamu faatu jira inni kun faa dhukkuba daddarbii kanaaf balaa ta'ee jechuudha. Hanguma kanan jedhaa I think Nadagesan today yada. So let me wrap up the central theme of my message. I would like to highlight a little bit in English because Oromo Diaspora Media was established 2 years ago. Since we established, we have been working with different organizations, including Sub-Saharan African Youth and the Family Services in Minnesota. At the same time, we are working with MDH, Minnesota Department of Health. At the same time, we are working with Welshare International, Ramsey County, Global Language Services, at the same time LG Interpreting Service. And there are many more organizations we are working with them. I know this organization, ODM, is a beginner, but we are doing great in order to serve our community in our profession. As many of you know, the media has 3 pillars. Those are one is to inform the community what's going on around, like giving information. Whereas the second one is to educate them what Sub-Saharan African Youth and Family Service is doing, especially to educate the people to get some information, especially how we are going to avoid putting the others under stigma or discriminating them or putting any kinds of bias and showing our approach to them. So more of education. Whereas the last but not the least is media is for sake of entertainment, but most of the time in our media, we don't have any entertainment program for the time being. So thank you very much.
Thank you so much, Iticha. I wish everybody can understand Afan Oromo, especially to listen to your poem. I can't translate his poem. It's a very interesting poem regarding HIV/AIDS when he was in elementary school and high school. So even though your organization is very young, you have been doing a lot of connection, a lot of collaboration and partnership with others. We appreciate that. Thank you so much for your hard work, especially when you do work with us. You did a lot of things, more than we expect from you. So thank you so much for that hard working. So I will, just to save my time, I will move on to the next presenter. That's gonna be in English. Mr. Asafa Wagjira. Mr. Asafa Wagjira is the guy who's preaching or teaching HIV/AIDS from the pulpit. HIV/AIDS and other related health problems in a community. It's not only preaching the gospel and quoting Bibles and so on, but practically he is preaching and teaching right from the pulpit. Thank you so much, Asafa. I'm proud of you. Always, I'm so excited what you've been doing. So go ahead, you have 5 minutes to go.
Okay, yeah, thank you so much. And it is great opportunity to work with Sub-Saharan Youth and Family Services, and also see other organization working with them. And it's also great to see Dr. Opsa here, who is really helping us a lot on the front of health, and especially on the COVID-19. I remember coming to the clinic and taking my 2 shots, and I'm waiting for my boost. I will come and get boosted very soon, you know. So I am from Redeemer Oromo Evangelical Church, one of the oldest Oromo church in diaspora here in Minneapolis. We have close to 200 members right now, and we have 2 services every week. One is on Sunday, the regular service that I mean all churches do, and another one is on service that we have on Wednesday, which is called we call it midweek service, that we do every Wednesday at 7 p.m. And so we, even before the pandemic, we have a live service that we transmit on Facebook and YouTube of our own church. So it has been one of our team that we present at least once a month on Wednesday services. So we talk about HIV and about HIV/AIDS. So our organization, our church, is also a community center. So some people come there for maybe for event, for wedding, for community meetings, and for different activities. It is not only a place for worship. So 2 years ago, I think before 2 years, I've heard that the Sub-Saharan Youth and Family Services are working with other religious organizations, with mosque, with Orthodox Church, with other Protestant church, and I was really kind of jealous, you know, like we should get this opportunity and work with them. And, you know, not only for the support that we get, but also it's very important to provide holistic service, you know. So we got that opportunity when Pastor Fikru, who is working on the outreach wing of Sub-Saharan Youth and Family Services, invited us or informed us there is opportunity for us to work with Sub-Saharan Youth and Family Services. And I'm really grateful, and we are also grateful as a church for that opportunity. And we took that information back to our church leaders, and they were very much excited about that. And that is where we started our cooperation and working together. So since then, we've been presenting importance of talking about health from pulpit in the church. And in addition to that, actually in our church, we have a team that works on the health that has been there maybe, I don't know, for maybe 10 or more years, even before I came to the United States of America. So we have that team, and not because of pandemic, we didn't work much with them, but I took it like personally, and also church took this responsibility, and we present importance of talking, first of all, importance of talking about HIV and AIDS, because usually the connection between HIV and AIDS, and church is kind of like, we don't want to talk about AIDS because AIDS come to people, or people get infected with this disease because of infidelity, or not having one partner, and kind of like we were kind of afraid talking about that. But now the impact that we got through this program is we normalize talking about HIV and AIDS from church. That is success for us, first of all. We don't know the impact, but the first breakthrough that we got is we're talking about it from our church. Second, we are informing people, and people who are attending our church service on Wednesday, some of them are in Canada, some of them are in Europe, some of them are in Africa. I don't know. Now you have to be proud of us. Like, this is a global impact. I don't know who is hearing what and improving their life. So we also talk, like, we brought together the theology of love your neighbor as yourself. So as a Christian, we are not allowed to discriminate now, whether you have HIV/AIDS or COVID-19. I mean, we know importance of taking care of that. I mean, the medical, Dr. Robsa and other people will say, okay, we should come together and hug each other. No, we know, like, taking care of other people, not pushing people away, and not to discriminate. And second, it also help us to have informed congregation, informed church about health. And we usually tell people the address of Sub-Saharan Youth and Family Services. And also, actually, it also helped us to continue to talk about COVID-19. We led many of our church members to a family clinic, for example, because we were the ones who take vaccine very early, because while we talk about HIV and AIDS, we also talk about COVID-19. And when the government is ready to give a shot for people, maybe 75% of our church members were vaccinated already. So what we are doing on the field of HIV and AIDS is not only helping us on HIV and AIDS, it also helps us on the side of COVID-19. And that I'm sure we have informed congregation, and that's another success. And my final message is that let us continue doing this together, like with a team. Second, one thing that I really like is we're now getting where the information is, where the resources. One of the problems that we have is there is a lot of resources out there for the immigrant community, for everybody maybe, but the problem is we don't have information. We don't know where different services are. So now this is helping us to get some information, or ask people, or lead people to places where there is information. And finally, I want to say again, let's continue working together, teamwork, and it's really great working with Sub-Saharan Youth and Family Services. And thank you for the opportunity to cooperate, and thank you for the opportunity to hear also from other religious organizations and other health organizations that we have here in Twin Cities. And thank you for the time. I'm sorry, that I'm preacher, so I don't know if it's not helpful.
That's okay. That's okay. Thank you so much, Asafa. I love the about the theology of life versus theology of love versus stigma and discrimination. So two things are very opposite, and then when you teach them together, people can get it easily. The other thing is about the resource. As we know, the resource is out there. We don't know where it hides. We have to find together. We have to come together and find the resources. Unless we are together, we cannot find out that resource. Still, there is resource. We are living in the United States, one of the wealthiest country on the planet, but still we need each other to find that resource. Thank you so much for that brief, good and clear presentation, Asafa. Thank you. So we'll move on. We have only 2 people left, and then we move on and go to Swahili. Henry Momanyi from Global Health Services. The
Yeah.
channel is Swahili. You have 5 minutes to go.
All right, thank you, and good evening, everybody. My name is Henry Momanyi. I will take 1 minute or two to introduce myself in English, and then I will switch to Swahili. Yeah, like I said, I'm Executive Director of Global Health Services. We are located here in Brooklyn Park, and Global Health Services came into service or started working in 2007, and we normally deal with people, African immigrants, refugees, and the people of color. And I want to thank Sub-Saharan Africa Youth and Family Services for their dedication and collaboration. We have been working together for the last 15 plus years. And I really appreciate your efforts trying to collaborate with the African agencies that deal in the African, in the HIV and AIDS. Yeah, so keep doing it, and we are there. Let us fight this epidemic. Global Health Services focuses on the early intervention and outreach services, whereby we focus on the education on HIV and AIDS, whereby we talk about what's AIDS and what is HIV to people in details. And then we provide them, screening or testing and referrals. Also, we provide some resources. I heard people talk about resources. What are resources? Resources can be even us here, we are resources. These agencies who are here now, you are resources in one way or the other. Then we have other things in details like, condoms and other things. Now, I am going to switch to Swahili. Karibuni sana. Kwa majina naitwa Henry Momanyi, mkurugenzi mkuu wa Global Health Services. Tuko hapa Brooklyn Park. Kazi yetu ni kuangalia vile tutamaliza virusi vya HIV and AIDS ambao kwa Kiswahili tunasema ni ukimwi. Njia gani sisi wale ambao tuko kazini ya kuona hii ugonjwa wa ukimwi tumeimarisha? Njia moja ni kushirikiana vile tuko hivi sasa, na ndio Asha nikasema nashukuru sana Sub-Saharan Africa Youth Service, Youth and Family Services kwa bidii kujaribu kutuunganisha sisi wale ambao tuko vitani na hii virusi vya ukimwi katika community zetu. Wamejaribu sana kwa miaka 15 na zaidi kutuunganisha sisi, kuambatana, kushirikiana, na hiyo ushirikiano ni kitu muhimu sana. Asha kwa sisi wageni ambao ni wakimbizi, ni katika viwango mbalimbali kama vile education, yani elimu, uhamiaji na mambo mengine mengi, kama wale ambao wanakimbia kwa sababu ya hali sio nzuri nyumbani kwetu. Kwa hivyo leo hii nataka kusema sisi kama wale ambao tuko vitani na hii mambo ya hii ugonjwa wa ukimwi, lazima tufanye bidii sana. Tuone kila mahali tuko ujumbe wa ukimwi kila mtu anaipata. Asha katika madhehebu mbalimbali ya kanisa kama vile United Central Church na zile zingine kama mosques, tunaomba kama vile nimeona ndugu yangu anasema huwa anahubiri kutoka kwa pulpit. Hiyo ndio tunataka sasa kabisa. Nilisikia Elder Daniel akisema juu ya stigma. Yaani stigma kwa Kiswahili ni kutokuwa na amani. Yaani kutokuwa na amani kusema juu ya afya yako, ama kuenda kupimwa. Naona, ama kuambia mtu niko mgonjwa. Hiyo kutokuwa na amani ndio tunasema stigma, na hiyo ndio lazima tuimarishe. Na mkutano wa leo ni kuangashia ni njia gani tutaweza shirikiana, kuambatana, kuja pamoja, kuona kasi yetu ya kukimbizana na hii ukimwi tunaimarisha. Kwa hivyo sisi kama wale ambao tuko kazini tusichoke. Tunaomba tuendelee kufanya bidii, na kuna resources. Na hizo resources tunasema ni vile makanisa na idara mbalimbali za serikali kama zile MDH, DHS, NBN County na community agencies kama zile Global Health Services, Sub-Saharan Africa na zingine nyingi kukuja pamoja kufanya bidii na kusema hii ugonjwa lazima tuimarishe. Ingawa COVID imeingia, najua COVID naye inaleta kasoro zake, lakini lazima tuzingatie ukimwi hiko. Ukimwi haijamaliza bado, lakini tunafanya bidii sana na naona kuna matokeo. Our work is, we are seeing our work. The way we are now teaching people from the pulpit kusema juu ya ukimwi, naona hiyo ni step ahead. Hiyo ni kazi mzuri sana, na hiyo ni moyo mzuri kutupatia moyo sisi wale ambao tunapigana na hii virusi vya ukimwi. Kwa hivyo sitaki kuchukua muda mwingi sana. Nataka kusema asante sana kwa kunialika na kuona madaktari wenye ujuzi wa kutibu watu wako hapa, tuwasikize, tuone vile watatuambia, na sisi ndio tuchukue hiyo ujumbe tupelekee watu wetu mahali ambao tunaenda kufanya hiyo kazi yetu ya kupigana na ukimwi. Asante sana. Thank you so much for this opportunity. And once again, I want to encourage everybody, and especially the agencies which are in front line, like Sub-Saharan Africa, Youth and Family Services, Global Health Services, and now the new partners that we have in our fight, like the faith-based. Please, let's keep fighting. The war is not over, but I think we are making strides. Thank you so much, and good evening.
Thank you so much, Henry Momanyi. Thank you so much for your presentation. Henry Momanyi, we've been doing on HIV/AIDS for the last probably 10, 12 years together. He's hardworking. The other thing is Henry Momanyi is running for public office. You better,
I want to be a mayor.
You better connect to him. Probably he's the one who is going to find the resource in the future. So
yeah, we wish him well.
So yeah, so I don't know whether Dr. Ofsa is. Do you have time? I have only one person to present. It's gonna take only 10 minutes. If you don't have any time, you can go ahead and let me introduce Dr. Ofsa. Dr. Ofsa doesn't want a fancy kind of introduction. I know him. He's a physician. He's a community organizer, and he's an outstanding community leader. I saw him leading our community. He is one of the humble person I have known. So Dr. Ofsa is helping us, as Afa said, he's been doing a lot of job around community services, not only in health aspect, but in different social services and different things. And then the Central Family Clinic is found in Minneapolis. It is on 3638 Central Avenue, Northeast Minneapolis. That is where you can get a culturally and linguistically appropriate services. The professionals are so easygoing, and then the customer service is stunning. I've been there for a long time, and I took my shot there. I'm coming for my booster dose, and then it is good to connect with this clinic because you're gonna get culturally and linguistically appropriate. You can talk your language, you can communicate with them. Thank you so much for being here, Dr. Ofsa. Dr. Ofsa is going to speak on the role of a partnership and a collaboration in ending HIV epidemic. So thank you, and then you have 5 minutes.
All right. Well, thanks for such a kind words, Pastor Fikru. Good evening, everyone.
Good evening.
It's so nice to see everybody. I was in Kenya in 1998. I was trying to hear Henry speak in Swahili, and I did pick up a few words from that. So thank you, Henry. Thank everybody for all you do. I'll be very brief. 5 minutes is usually, for Africans, it's not a long time, right? So I'll be brief. It just happens that in 2008, we translated an article about the state of HIV/AIDS in Oromia. And among Oromo diaspora, there was a book written by Dr. Ibrahim Elamo, and we translated that book to English with the help of Demi Orma, who was a former Al Jazeera journalist, and Professor Stephen. And that article, in the same issue, 2008, Ephraim also had an article about HIV, and there is Sub-Saharan Youth and Family Services talking about HIV. So today, in 2001, here we are talking about HIV in this meeting. So Pastor Fikru, thank you for inviting me. This is absolutely necessary to have a family partnership, a community partnership in ending epidemics like HIV, epidemics like COVID, because as you guys have heard, our pastor, Pastor Wakjira and Pastor Fikru have been the forefront, not just as a healthcare workers, but as people, community leaders. We've been to Oromo mosques and churches. We've been to Ethiopian Orthodox Church as a healthcare community healthcare center, and we've been to Oromo community and provided a COVID vaccine education and kind of dispelling the myth. And the stigma around HIV, as you guys know, is huge, especially for our community. And the community partnership with support agencies such as Sub-Saharan Youth and Family Services, the MDH, is key. I think Oboiticha knows, as a media person, the importance of having a faith leader, a healthcare provider like myself, and it's all the stakeholders to the table so that we can move the ball forward. And two things that I wanted to highlight is that HIV globally, it affects especially the Sub-Saharan countries heavily. For example, I was just looking at the WHO website. Since the 1980s, when HIV first discovered, about 79 million people have been affected by this disease. 36 million have died from it. And as of 2020, about 37 million people worldwide live with HIV. The majority of that is Africans, people of African descent, specifically the Sub-Saharan countries. And 1 in 25 people of adults have HIV in that region. And Sub-Saharan African accounts for 2/3 of all HIV cases in the world. And so that is a huge number. And we, as people of that region, is absolutely critical that we understand these statistics. These are just not numbers. These are actually individuals, family members, our community leaders, our mothers, our brothers and sisters that are affected by this disease. And it requires, as the African proverb goes, it requires a village to raise a child. But when it comes to pandemics and epidemics like HIV and COVID, it requires the whole global community to eradicate this deadly disease. And the community partnership is key in that. Building the partnership to facilitate, awareness creation, education, effective communication that are relevant to the communities that are affected is really key. That goes along with faith-based leaders being front and center of this, because that's where the trust comes. In this country, in America, people don't trust, specifically marginalized groups don't trust healthcare system a lot of times. So if it comes from a person like me, or if you came to our Access Family Clinic on Central Avenue and you see your own people there, I think that breaks a lot of the barriers. And that is what it requires, trustworthy individuals from across a section of the community coming together and speaking in one voice to help the community to understand, and not only to understand, but also to take action. As a healthcare worker, every day I face with people coming for annual physical, and I gently say, hey, even if you have no suspicion of having an HIV, Center for Disease Control and Prevention recommends an adult of age 18 to 65 to get HIV screening once in their lifetime. They'll say, oh, I don't want to get an HIV screening. Some will say, yeah, I think I want to know. And I think that's where, as healthcare doctor, we sit down and talk to people and kind of meet them where they're at. Because a lot of times, if you don't tell them where this recommendation came from, sometimes they might be frightened. So we tell them this is a recommendation for across the board. For people of low risk, we recommend checking that. And I haven't come across anybody so far in our Access Family Clinic, just from a screening standpoint, who we have diagnosed with this disease. But I work in the hospital. I went to high school here. I grew up here. I went to college and medical school here at the University of Minnesota, and then trained at Abbott, which is a large hospital here in Minnesota, found in the one of the largest hospital in the Twin Cities area. And there we see people, because it's located right in the city. We see people who come in for heart attacks or diabetes complications, but they have HIV that is either well managed or not managed. And so it is important that as Sub-Saharan Youth and Family Services, to go to the people where they are at. Like Pastor Asaf Wagjira, what he's doing is reaching audience at a global level, as he was informing us that there are people who follow the programs that they have across the globe, because we live in a globalized society now, well interconnected, and we should use this opportunity to teach people and empower them so that they take health into their own hands and help the community. If we can help one individual, we can help the community as a whole. So I will stop there. If there is any burning question, I can answer that. But we are all in this together. Let's fight the good fight. And as most of you already said, COVID vaccine, if you had it more than 6 months ago, if you're above 18, the booster is recommended because the immunity wanes, and it is time to get the booster as soon as possible. Talk to your healthcare worker, come to our clinic, and we're happy to help, not only for the vaccine itself, but as Pastor Fikru was saying, it's really a nice center. We have people of all backgrounds, people who are very competent, or who are there and willing to help you through your journey of taking care of your health, for your diabetes screening, for blood pressure screening, for annual physical if you need. All the primary care services that you need, we have it, and you should come. And it's a beautiful clinic. It's very spacious, very clean, and the people are outstanding over there. And now I'm not speaking just as someone who founded the clinic, but I'm really proud of the team, because it actually requires teamwork to deliver what we deliver at Access Family Clinic. Even though originally we started that clinic as Central Family Clinic, it's now called Access Family Clinic because of our affiliation with 2 other clinics in Minneapolis. So I want to thank you for this platform, and we should continue working together. Thank you, Pastor Fikru. Galatoma.
Galatoma. Thank you so much, Dr. Opsa. It seems COVID-19 overshadowed everything, but when COVID-19, HIV/AIDS is COVID-19 is going towards the HIV/AIDS situation, because sexually transmitted disease and other infections are very related with COVID-19. So people should not ignore HIV/AIDS. Most of the time, people are talking at this time about the COVID-19, and COVID-19. Those people who are living with HIV/AIDS are highly affected by COVID-19 deaths and illness. So thank you so much. As I've said, the clinic is very neat, and those people are very wonderful people. I've been there so many times, so it is good to use the clinic. Dr. Opsa, you will be excused if you've been busy the whole day, and then thank you so much for that brief and very important presentation. You will be excused to
Yes. One last thing, Pastor Fikru, if I may. You mentioned that HIV, it affects your immune system, and your immune system is very important in defending you against pathogens like HIV, against COVID, against common cold. And people who are living with HIV, it's so important that they get the vaccine, right? I just wanted to highlight that. And because Allah, God created us because we are feeble beings, but at the same time we have defense mechanisms, and if our defense mechanisms are not well taken care of, we can succumb to diseases. So I wanted to emphasize getting the vaccine, getting good sleep, hygiene is very important. Taking just basic measures, washing your hands, avoiding crowded places, even if you had your vaccine, because people who had both of your shots, chances are, even if you contracted by COVID right now, you might not get sick, but you can still transmit it to someone who is weak in immunity, especially people with HIV. So once again, thank you. I have to jump off because of other work that I have to finish, but I'm really I'm humbled to be with you guys. Thank you. Galato.
Thank you so much. We are so glad to hear from you. Thank you, Dr. Osman.
Thank you. Thank you. Galatobi, Doctor.
Galato.
Okay, we have someone. I have one presentation in Amharic, not Afan Amharic, in Amharic language. So I don't know whether Haile is in. He's getting hard time to get in. I don't know. I've been just communicating with him so many times. He's
He's in.
Fortunately, he's here. So you can go ahead, and he's gonna take only 3 minutes. So at the end, probably if our executive director, Mr. Ephraim Olani, will give a brief closing remark. If any, but I didn't tell him, but I just, I want to surprise him to say something at the end. Yeah, so Aile, go ahead. Aile is gonna have 3 minutes to make his presentation in English, in Amharic language.
Okay, አመሰግናለሁ ስለነበረው የቴክኖሎጂ ችግር በጣም ሶሪ ባጭሩ ምንድነው እኔ ኃይሌ ይባላለሁ ሰብሳሃራን አፍሪካን ተቀላቀልኩት የዛሬ 3 አመት በፊት ነው እና ሲሰራ የነበረው በኬዝ ማኔጅመንት እንዲሁም ደግሞ በኬዝ አድቮኬት ነው እና እሱም ብዙ ጊዜ ከክላይንት ጋራ ሶሪ ባጭሩ ምንድነው እኔ ኃይሌ ይባላለሁ ሰብሳሃራን አፍሪካን
Aile እየደገመ ነው አንተ የተናገርከውን እየደገመ ነው ሁለት ነገር ከፍተሃል
ሶሪ
አንዱን ዝጋ ሞትም ተደርገሃል ሚውት ኦኬ እና ምሰራው በዛ በኬዝ ማኔጅመንት ወይም ኬዝ አድቮኬት አካባቢ ነው ብዙ ጊዜ ደግሞ ይሄ ስራ ከክላይንቶች ጋራ በቀጥታ የሚያገናኘኝ ነው እና ሌት ቀን ከክላይንቶች ጋራ አብሬ እሰራለሁ ይቅርታ ባንድ ጊዜ sorry for the glitch Haile is fighting with technology. This is what.
Yeah, it's a technology.
Yeah.
It's not easy. Sorry. Right. ብዙ ጊዜ ከክላይንት ጋራ በየቀኑ የሚያገናኘኝ ስራ ነው የምሰራው በተጨማሪ በሁለተኛነት መጥቀስ መፈልገው እኛ ፓርትነርሺፕ አሉን ምናልባት ከዚህ በፊት ብዙዎቻችሁ ጠቅሳችሁታል እነዚህ ፓርትነሮች ብዙ ጊዜ ኮሚኒቲዎች ናቸው አብያተ ክርስቲያናት መስጊዶች ሌሎችም የበጎ አድራጊ ድርጅቶች ናቸው ከነሱ ጋር ነው የምንሰራው። በአብዛኛው ከነሱ ጋር የምንሰራበት ምክንያት ሄልዝ ዲስፓሪቲ ወይም ኢፍትሃዊ የሆነ የጤና አገልግሎት ስርጭት በመኖሩ ምክንያት በአብዛኛው ይሄ ደግሞ አፌክት የሚያደርገው የሚጎዳው ወይም ተጽዕኖ የሚያደርገው የቋንቋ ችግር፣ የቋንቋ ልዩነት፣ የባህል ልዩነት እንዲሁም ደግሞ የኢንፎርሜሽን ልዩነት ማለትም የትምህርት ልዩነት ባላቸው ሰዎች ላይ ከፍተኛ ተጽዕኖ ያደርጋል። እነዚህ ደግሞ ብዙ ጊዜ የሚመጡት ከሳብሳሃራን አካባቢ ናቸው እና የኛ ስራ ምንድነው እነዚህ ፓርትነሮች ጋራ በመሆን ይሄንን የሄልዝ ሪሶርስ ወይም የጤና አገልግሎት እንደማንኛውም ግለሰብ ፍትሃዊ በሆነ መንገድ የሚያገኙበትን መንገድ ለማመቻቸት እና ይሄ ደግሞ የጤና አገልግሎት መገኘት መቻሉን በማስተማር በማንቃት በማደራጀት ይሄን በማከራቸው ተገኝተን ቅስቀሳ በማድረግ ደግሞ የኤችአይቪ ምርመራ በማድረግ ይሄንን በመሳሰሉት ቅስቀሳ እናደርጋለን ህዝቡ አዌርነስ እንዲኖረው ይሄ ነገር ህክምናውን ማግኘት እንደማንኛውም ማግኘት እንደሚችሉ ሊንግዊስቲካሊም ካልቸራሊም አፕሮፕሪየት የሆነ ሰርቪስ ከሚሰጡ ጋራ እኛም በመጎዳኘት ወይም በመያያዝ በጋራ ሆነን እየሰራን ያለ ነው። ሌላው ደግሞ ከዚህ ጋር አብሮ ሊሄድ የሚችለው እነዚህ ፓርትነሮች ደግሞ ከኛ ጋር በሚሰሩበት ጊዜ ኒውስሌተር ያሰራጫሉ፣ ያስተምራሉ፣ በሬዲዮም ያሰራጫሉ፣ በቴሌቪዥን እንዲሁም በዩቲዩብ በፌስቡክ ይሄንን ሁሉ ያሰራጫሉ፣ ያስተምራሉ። ይሄ ምንድነው ሰው ግንዛቤ እንዲኖረው ግንዛቤያቸውን ከፍ ለማድረግ ይሄ ኢፍትሃዊ የሆነውን የጤና አገልግሎት በተመለከተ ህዝቡ አውቆ ይሄንን ማግኘት እንዲችል ኮኔክት እናደርጋለን በማስተማር በማንቃት ማለት ነው። እና ይሄ በአሁኑ ጊዜ ከፍተኛ ተጽዕኖ እያመጣ ነው። ምንድነው ውጤት እያመጣ ነው፣ አወንታዊ ውጤት እያመጣ ነው። ህዝቡ እየነቃ ነው፣ ህዝቡ እየተሳተፈ ነው። እንደው ለማሳጠር ያክል ወደፊት ምንድነው ማድረግ የምንችለው በአማርኛ ድር ቢያብር አንበሳ ያስር ይባላል። እና ድር ማለት በጣም ጉልበት የሌለው አቅም የሌለው ነገር ነው፣ አቅም የሌለው ክር ነው። ነገር ግን ያ ክር በሚተባበርበት ጊዜ አንበሳን የሚያክል ኃያል ነገር ሊያስር ይችላል። ስለዚህ እኛ ከሳብሳሃራን የመጣ ማናችንም ይሄን በተመለከተ ህዝባችን ደግሞ እዚህ ያሉትን ኮሚኒቲዎችን የእምነት ድርጅቶችን፣ ተቋሞችን፣ የትምህርት ተቋሞችን፣ የጤና ተቋሞችን ይዘን አንድ ላይ ብንተባበር ይሄ የጤና ፍትሃዊ በሆነ መንገድ ሰው ህክምና እንዲያገኝ በተለይ ሪሶርሱ ኤችአይቪ ወይም ኮቪድ በተመለከተ ሰዎቻችን ሳይቸገሩ በቋንቋ ገደብ ሳይኖር በትምህርት ወይም በኢንፎርሜሽን ገደብ ሳይኖር በባህል ገደብ ሳይኖር እንዲያገኙ ለማድረግ መተባበር ግድ ነው ማለት ነው። ስለዚህ እንተባበር እንያያዝ ነው ማለት ነው። አመሰግናለሁ። ተባረኩ።
Thank you so much, Haile. That is so clear and brief and very important points. Haile is also making a kind of proverb. I can't translate that proverb. That is what he want to say is just we have to unite together to dig out the resources and to bring our energy together and work together. That is what he's emphasizing on. And he's talking about the barriers, about the importance of partnership and so on. So thank you so much for that presentation. And then this is, we are going to wind up our presentation. If Mr. Olani has something to say, a closing remark. I'll give him a chance to, if he's, I didn't tell him just to speak, but if he has something to say, he can jump in.
It's kind of surprise. Yeah, that's good.
Yeah, thank you very much all. Specifically, I want to thank the coordinator to have his time and skill so that to bring us together and creating this platform. I can vividly remember 16 years ago when we started the first African World AIDS Day. Probably Dr. Harare was there, I'm not quite sure, but 500 to 700 people gathered at Brian Coyle Auditorium. It was a huge celebration. So it was the first of its kind at then. Celebrities and very famous doctors, legislators, many people really showed up that time. So since then, this African World AIDS Day has been going on, even though the incidence of the HIV has not been dropped that much. So one thing that made me really very happy today is that we have a multitude of partners, very vibrant, enthusiastic partners to combat HIV/AIDS together. This is really wonderful. This is the impact or the outcome of the 16 years service. So I really very grateful for this. Specifically, the media is there right now, the churches are there, community members are there, the clinics, even community partners, everybody is there. So this is really very interesting and very good. I have really a huge hope that we will really continue fighting this incident. So some of you talked about the resource, that there is a scale of resource to fight this HIV/AIDS. But I would say that the resource is there, even though it's not money, the resource is there, but the problem is the accessibility. So even though the resource is there out there, we have a very, very limited access to that resource. Sometimes we just watch, we just sit down and then look the resource when others are using the resource, because we cannot access that resource. So in order to be able to access to that resource and then utilize that resource, we really need to fight together, really need to struggle to move together, together. So that is what we're lacking in the African-born communities. So probably in the future, we will work together and then plan how to access the available resources out there. Thank you very much for your time. And above all, thank you for the passion you have for people living with HIV/AIDS, and also the passion you have for our community. Thank you very much. Thank you, Mr. Coordinator, Mr. Fikru.
Thank you so much, Ephraim. Thank you so much. Ephraim, I've been there for the last 16 years, 17 years. He never missed one of the African World AIDS Day, and then he's one of the founders. So Mr. George is with us. The reason why I didn't just make him as a presenter is I couldn't get hold of him the last week, and then I don't know whether he's ready or not. I didn't know what language you want to present with, and that is why I just kind of hesitant to ask you to present. If you have anything to say, you can just use 2-3 minutes, and we'll finish our program in 2-3 minutes. I'm sorry.
Okay, thank you so much. I didn't know that we had two. Okay, actually, my name is George. The last name is Obara. I was asked by our elder George Mochi to stand in for him tonight. That's why you didn't hear me, but we had already had information from our last meeting. So I wouldn't have much to say, but I just wanted to identify ourselves that we are in partnership as well. So I am from the Mountain Experience Church, which is an affiliation within the United Central SDA Conference. So together with Elder Basweti, we kind of share the same message. So again, I just want to say thank you so much to the Sub-Saharan Africa and Family Services with the Global Health Services, those with Henry, where you come in. Those are our common community resources that we use. So as a church, so many of you have already mentioned that. So as a church, we fellowship at the Mountain Experience Church. The address that is 7686 Long Lake, as you have mentioned. So we have been working hand in hand with the Sub-Saharan Africa just to give that information to our people. It's true, the Global Health Services headed by Henry Momanyi has done a very good job trying to get the information to the people. Often, as it is in Minnesota, most of the time people then don't have the much time to attend to those meetings of awareness and education where everything is. So as we mentioned, we have brought that one to the church in an effort to expand that information to all our congregation. And since we have been talking about that, yes, and now also I'm excited that we have known about Access Healthcare, where we can get culturally appropriate care. So that's an addition to this collaboration. So our people now have had a great chance to hear about the causes and prevention of HIV. We especially still have to understand we don't have a cure, but we still have management, medication just to manage these chronic conditions. Reducing stigmatization has been our goal to help those who already have been affected to cope and live comfortably within the community. However, because we understand HIV affects your immune system, so stress alone can also affect your immune system. So we encourage about people living a healthy lifestyle, whereby they can eat healthy, rest, and obviously diet is another issue where we emphasize that good diet will also help you, improve your immune system. So not to go over what we already said, as you mentioned up, we didn't communicate much, but so I don't want to repeat most of it, as we have already mentioned, and the doctors and other speakers have already said. So growing up in the 80s, of course, we knew that having HIV was like more of a death sentence. That notion is what we are working on to eliminate from people so that they might not go on living such a kind of stressful lifestyle. So not only that, of course, we mentioned about coping and working on the resources available to help. So with Sub-Saharan Family Services, Global Health, Access Health, I'm so confident as we move forward and continue working together as this, because most people who are underinsured or uninsured have issues meeting the healthcare that they need, where they can receive the care, which is more with a non-judgmental attitude. So thank you so much. I didn't have much to tell you, but that's a little bit that we wanted to tell you, that we are happy to be cooperated with you. And as we go with with the Oromo and everybody else, so our horizon is expanding, and the more it expands, then we are likely to get people get more access to healthcare and reduce the disparities that we see in our community. Thank you.
Thank you so much, Mr. George. You kept the best for the last presentation. Thank you so much.
Thank you.
I'm sorry, I didn't know that you have a presentation because I couldn't get hold of you guys for the last probably a week. So you nailed down on the stigma. That is a very chronic problem in HIV and related sexually transmitted diseases. So whenever people are stressing on the stigma, I always I've been in this job probably for 2 decades. So stigma is still a chronic problem. Still people are A lot of people want to come out and they speak about HIV/AIDS, but they are always in fear of this stigma, chronic stigma. So we have to work hard on that. Thank you so much for that brief and very clear presentation. Thanks so much.
Thank you.
I would like to thank everyone. This is you are very punctual. Everybody comes, 3 minutes, 4 minutes, 5 minutes, and even an hour earlier today. Thank you so much for doing that. And then we keep in touch. You are a good partner with us, and then we continue to learn from you, and we continue to work with you. Thank you so much. If anybody has something to say, any message, any remark, you are welcome. I can give you 30 seconds. So otherwise, we are done.
Thank you.
Yeah, the roads are not good, so be careful. Outside there, it's not good.
Very careful.
Okay, out from, okay.
Yeah.